What to expect during a stroke swallowing assessment. Imagine suddenly feeling unsure when swallowing or noticing food sticking in your throat after a stroke. That's why a swallowing assessment is so important to keep you safe and well-nourished. When a person has a stroke, they often develop difficulty swallowing, called dysphagia, which can increase the risk of food or liquids entering the airway, leading to aspiration or pneumonia. To prevent this, hospitals perform a swallowing assessment usually within the first 24 hours after admission, before allowing any oral intake like food or medication. The process begins with a quick initial screening conducted by trained healthcare staff. They check if you are awake, alert, and able to follow simple commands. During this screening, small amounts of water or saliva are offered to see if you can swallow safely. The staff observe 4 signs of trouble such as coughing, throat clearing, or changes in voice quality. If you swallow without issues, you may be allowed to start eating or drinking with close monitoring. If there are signs of difficulty or risk, oral intake is stopped, and you are kept NPO, meaning nothing by mouth, until further evaluation. This quick screening takes less than 5 minutes and helps decide whether more detailed testing is needed. Next, a speech-language pathologist or a specialized clinician performs a detailed clinical assessment. They evaluate your ability to swallow saliva and perform various throat tasks like coughing, yawning, or humming. They also ask you to swallow small amounts of water or food of different textures to assess muscle strength and coordination. This helps identify specific problems in the swallowing process and whether your airway is adequately protected during swallowing. The clinician looks for signs of weakness or delayed reflexes that could increase the risk of aspiration. If the clinical assessment suggests significant swallowing issues, more advanced tests might be recommended. These are called instrumental assessments and include procedures like videofluoroscopy, also known as a modified barium swallow. During this test, you swallow foods and liquids coated with a special barium contrast while a moving X-ray captures the swallowing process. This allows doctors to see exactly how food moves through your mouth and throat and whether any material enters the airway. Another option is fiberoptic endoscopic evaluation of swallowing, where a thin, flexible camera is inserted through your nose to directly visualize your throat and larynx during swallowing. These tests provide detailed information to help plan effective treatment strategies. Throughout this process, careful monitoring continues. If you pass the initial screening, you will be observed during your first meals to ensure ongoing safety. If you fail the screening, you will remain as NPO, and your hydration needs are managed through alternative methods like Roman 4 fluids. You may also be referred to swallowing therapy, which can include exercises and techniques to improve swallowing function. Repeat assessments are common, especially if your condition changes or if you are recovering, to track progress and adjust treatment plans accordingly. Throughout all these steps, safety remains the priority. Healthcare teams take precautions such as withholding oral intake when necessary and maintaining good oral hygiene to reduce the risk of pneumonia. Depending on the assessment results, treatment options like swallowing therapy or neuromuscular electrical stimulation may be introduced to help regain safe swallowing. In summary, a stroke swallowing assessment involves a stepwise approach starting with a quick screening to identify potential risks, followed by a thorough clinical evaluation, and, if needed, detailed instrumental tests. This comprehensive process helps ensure that you receive safe nutrition and hydration while minimizing complications. Always remember to consult your healthcare team for personalized advice, as each person's recovery journey is unique and requires tailored care.